Dr. Lucie Bianchi, and this is the Mindful Medi Spa and Medi Clinic. And today we have with us Dr. Rrashmi Kapur, who is a retina specialist. She has a practice in Elgin called the Retina Health Institute, and she also has an extremely long and impressive academic career, and I'm not sure we have time to go through every single thing that you've done because it's like so many publications, writing chapters for books, valedictorian of your medical class. Good Lord. This is one smart lady. So if you're looking for some good advice or good recommendations to how to keep your eyes healthy, we have the right person with us today, and we're very lucky that you could take time out of your schedule. So thank you for coming.
No problem. Anytime.
So what made you interested in eyes?
So actually, I have a family history of blindness, like in my family. My grandmother lost her vision going to a cataract camp in India, and they dilated her pupils, which threw her in angle closure glaucoma. And so back then, she was in the hospital for a month getting her cataract removed and then treating the glaucoma, and eventually she lost all her vision.
Oh, so that's terrible.
So seeing her, and then I had a couple of aunts have ocular problems, it drew me to eyes. In medical school, when I entered, I was thinking neurosurgery. Like I wanted to be a brain surgeon. That was the most exciting part of medicine to me. But when I did my neurosurgical rotation, I wasn't too happy in the OR for 8 hours on end.
I can imagine those are long, and there's got to be a lot of sad stories because
there's not a lot of help that's done from everything. So then, when I did my ophthalmology rotation, and I liked surgery because I wanted to be able to help people physically with my own hands or with my own handiwork.
Mm-hmm.
It was awesome. I was like, these doctors get to sit down and operate. They don't have to stand on end.
Right,
and
sure, that makes a big difference.
The patients, their vision is spectacular the next day. They're so happy. And the coolest thing about ophthalmology is you can look into the patient's eye and know exactly what they're going through just by looking in. So when a patient comes to me with, doctor, this and this is going on, I can look and see exactly why they're having those symptoms. So I don't have to order an x-ray or a blood test, or, we do some imaging, but my exam is so key in making the diagnosis that I really feel the patients have high satisfaction because I can answer their questions right away.
Sure.
So I really liked that about ophthalmology. That was a huge draw to me.
Right.
And then I think the neurosurgery part of me was just drawn to retina because that's derives embryological
eyes and the brain, very connected. You can't see without a brain.
Right.
And all that. Yeah. Well, that's really, really cool. I think that when you have a passion for something, automatically you're just going to be really, really dedicated and really good at it.
Yeah.
And I think that's sometimes what people don't understand when they look for jobs. Like, go with something that you have an interest for or a passion for, and then your work, even if it has super long hours, doesn't feel like work.
Right. And it just feels like you're enjoying what you're doing.
Yeah,
so.
Absolutely. And it sounds like people can't lie. Oh, yes, I've been taking my cholesterol medicine. Oh, really? That's not what your eye says.
Blood pressure is the biggest thing. So what are your numbers running? And then they're like, I don't know, doctor. Well, let's chart them, and then I'll have you come back for an angiogram, and we'll see. And then you just look at the numbers, and it's like 150s over 90s, and you're like, no, you're not controlled,
Right.
Or yes, you need to take that medication your doctor said, and now you have a broken blood vessel in your eye, and we're gonna have to start these injections because you didn't listen to your doctor.
Right.
Or, I see so many people nowadays in their 40s who still haven't gone to a primary care doctor. And that's they don't realize diabetes, high blood pressure, all this stuff starts early.
They're very silent.
Yeah.
Now, when do you think is a good time for the first eye exam?
I mean, I love that the schools require that children have to have screening for glasses because we know that children can develop lazy eyes. Basically what happens is that if a child doesn't have the correction they need, they can't form the connections to the brain. And so what happens is they never got the glasses at the time they were supposed to get them. They didn't form the connections to the brain. So the brain is like, well, I'm not going to control this eyeball anymore. It's not giving me any good images. And then the eye drifts out of it. So that's kind of how lazy eyes start in children. So, but I think that they need to couple those with dilated exams.
Sure.
Early dilated exams can give us so much information. And there's a lot of diseases that patients just don't realize come from the eye. I treat ocular tumors as well, and I've had 20-year-olds with ocular melanoma, and they just don't know that they have a melanoma sitting there because it's not going to cause any symptoms, it's not going to cause any pain, and they don't realize until it's too late that they have a cancer growing in their eye.
Sure.
So I think annual dilated eye exams are very, very important.
At all ages.
At all ages. I definitely believe that. And nowadays, there are a lot of optometrists out there that can do imaging of the back, and you don't even have to get dilated. You know, if you're in a rush or whatever, you can go in and they can take a picture. It's called like an optomap, is usually what the optometrists do, and they can just, with an undilated pupil, get an image of the whole retina. And you know, most good optometrists will pick up things right away and start the referral process. Do we sometimes get these like questions about things that are not, you know, important? Yes, but I think that it's like $100 test, you know what I mean? Like, it's such a small thing that you have now documentation.
Right, and once you lose your eyes, there's no replacement.
No. So like, I've had patients that were getting these like pictures done, and then we can actually see a freckle is actually growing. We can go back and look at that and then say, okay, well now we know that this freckle is growing. This is cancer, it's not just. So I think annual eye exams with dilation are very, very important. Whether you go to an optometrist or you go to an ophthalmologist, always get a dilated eye exam.
Right, so they can see better, absolutely. Yeah. So what's other things that people can do besides like being dedicated to their health and getting that exam once a year? What's something they can do every day to protect their eyes?
I think that nowadays people are, you know, drifting towards healthy lifestyles as it is, right? Mm-hmm. We're much more conscientious of how we eat and where our food is coming from, and exercise, and all of those things affect your eyes. So if you're a patient who has diabetes and you're controlling your sugar and your retinopathy we can see is progressing, well, sometimes we find out that the person also is anemic, and that's why they're having, you know, progression of vascular problems in the eye. So just, you know, healthy lifestyle, exercise. We know obesity causes problems like macular degeneration, will lead to progression of disease. We know it's linked to diabetes.
What about supplements? Are there supplements that people can
So
take?
I'm not a huge supplement fan. I feel like if you take things naturally, it's better for you. For patients with macular degeneration, we do advise that they take the AREDS 2 formulation of vitamins. Mm-hmm. That formulation was not shown to help patients that didn't have the disease. Okay, so let's say you have a strong family history of macular degeneration, but you don't have any disease now. Well, then just eat healthy. You know, you want to get lots of green leafy vegetables. You want to watch your salt intake. You want to, you know, exercise. Make sure your weight is down. Don't develop diabetes, or if you're a diabetic, make sure you control your sugars, control your blood pressure. All of those things will affect whatever the diseases are that you are genetically bound to get down the road. And then the biggest thing is smoking. Smoking with macular degeneration has shown to increase your risk of progression of disease by 70%.
Wow,
which is huge.
A lot.
And it took so long for the Surgeon General to put it on the actual packing of cigarettes,
sure,
which is amazing.
But now we have, I think, probably a large decline in tobacco smoking,
correct,
but an increase in marijuana smoking and vaping, and I think they smoke other things besides that. Like, obviously, that's having effects on the lungs and on younger people.
Correct.
But what are you seeing in the eyes as far as that goes?
I mean, we're not seeing the vaping yet because most of our diseases are more like the Medicare population, so it takes more time for it to hit. But, you know, patients will tell me that they lived with a spouse that smoked, and then I can see how much damage it caused their macula from secondhand smoke. So the generation I'm seeing with those vascular problems are probably 40 and up, so I'm not seeing the vaping consequences yet. But I mean, if you look at the reports on what it's doing to these kids' lungs, it's horrible.
It's common sense.
So it's going to affect, it will affect your retina eventually. So don't vape. That's a very bad thing to do.
Smoking anything,
Yes.
not good for your body. However, I think it's encouraging for people to know that it's actually kind of easy to take care of your eyes.
Yep.
It doesn't cost you any money. You don't have to buy anything special.
No.
You just have to eat healthy, which also prevents diabetes, obesity, and everything else.
Right.
So,
And controlling all those things, seeing a primary care doctor. You know, I had a patient tell me the other day, like, why do I have to get an eye exam if something hasn't happened? And I'm like, you don't want something to happen before you get something fixed. The idea is prevention. So we
Right.
want to make sure we're staying healthy so that we don't have that problem, you know? So the same thing is like, make sure you're seeing a primary care doctor, because you won't know that you have these problems until you actually go in and get checked.
absolutely, and it's a lot of things to remember. When do I get my eyes done? When do I get my PAP done?
Yeah.
When do I get this immunization? And it's constantly changing. It's really challenging, I think, for anybody to keep up with. I mean, I'm sure you have a doctor, I have a doctor.
Right.
You know, we can't keep up with that stuff for ourselves either. Let's see. Another thing that I wanted to talk about as in simple prevention health is sunglasses. The importance of wearing sunglasses. Like where do you gauge that importance, and how would you advise someone on buying like a quality pair of sunglasses?
So the wavelengths of light that affect the eye or the retina is the blue light, and then UVA and UVB. Those are the three, you know, shorter wavelengths that are really more damaging to the eye. If you want to get a good pair of sunglasses, you need to ask, because most sunglasses will only block UVB. And so you have to specifically ask, like, will it, you know, tackle UVA? And that would probably be how I would approach it. We know, looking at observational studies, that people that are out in the sun more get cataracts more often, get macular problems more often. So there is, you know, evidence that sun can cause damage to the eye. We don't have good prospective studies because it's really hard to sit there and quantify sun exposure from one patient to another patient.
Sure.
But we know macular degeneration happens more often in less pigmented populations. So people of Northern European descent are more likely to have age-related macular degeneration. Now, that being said, you can be African American or Indian and still have it, but it's just more common in the patients that come from Northern European descent.
Does eye color have an impact, or just pigment?
So then it's pigment in general. So so if you're lighter skin, you're more likely to be blue-eyed, you're more likely to have less choroidal pigmentation. So all of that, you know, correlates.
All that correlates together.
Just like, you know, it would be rare for someone like me to get skin melanoma, but more common for someone with your skin type to get.
Sure.
So it's the same type of protection.
So a quality pair of sunglasses should have UVA and UVB, and there's a lot of maybe non-specific data to support that we all need to protect ourselves from the sun. But I guess that goes along with other things too. The other thing that I wanted to talk about, because my patients are always interested in like myths, and there's common myths, and one of the common myths and stories out there is that carrots are good for my eyes, and we did kind of talk about how diet's important, and you are what you eat, basically.
Right.
But are carrots specifically like awesome for your eyes?
So if you say, I'm gonna eat 5 carrots a day for like the rest of your life at the age of 5, is it going to like prevent you from getting glasses? No. Is it going to, you know, make your eyes quote unquote healthier? No. But the vitamin A and the precursors that come from carrots are important for, you know, patients that have macular degeneration or other macular problems. There's some like inherited retinal degenerations like retinitis pigmentosa. So in those situations, yes. But, you know, I wouldn't say like carrots themselves can prevent eye disease.
Because there's a lot of other foods that have vitamin A.
Yeah, and you want, you know, antioxidants and lutein and zeaxanthin, but again, I'm more of a fan of getting these things naturally than taking supplements.
Sure, okay, so it's more than just carrots, good. Are there any other myths that you think that are out there that people incorrectly think about eyes and eye health? I mean, I think we touched on some, like the myth that you only have to look at your eyes when there's a problem.
Right.
That's one.
That's the major myth. And tipping on that is, you know, patients don't even realize that they have tears or holes in their retina, and then they get a detachment. So I think getting a good dilated eye exam is just very important every year. But basically that, you know, all of the eye problems only affect really old people. which is not true. I mean, people in their 40s are getting cataract surgeries these days, and you know, like retinal detachments definitely happen about the time,
that's an eye
40s and 50s.
really.
Yeah, there's a gel that sits in front of the retina called vitreous, and as you get older, that vitreous will tend to shift. And normally when that vitreous shifts, the risk for a tear is less than 1%, but if we can catch that tear, then we prevent a detachment. So if you have new floaters or flashes, you need to get an eye exam right away. So that, I think, is like a big thing, that eye problems only affect really old people. I mean, one of the things I like about ophthalmology is I see kids that are 3 years old, and I see, you know, 90-year-old grandma as well.
So you get a nice variety.
So I get a good range of patients, because we'll have children with, like, you know, juvenile rheumatological problems that they need to be seen. And then there's a lot of, you know, retinal diseases that affect premature or previously premature kids. And so we see that whole range of population, which makes things interesting.
So in your population that you see at large, you're referral based. So once there is a problem identified, that's the time to see you. But at the same time, and I hope you were listening, Dr. Kapur recommends getting an eye exam every year from whomever you trust, so that you don't have to spend all of your days with her, although she's very pleasant.
Especially the diabetics. Make sure you get your diabetic eye exam. That's
absolutely right. We can't stress that enough. And just because you can't feel your sugar going high doesn't mean that it isn't high. Thank you so much for giving us all this information. I think that people are going to watch this and rewatch it, because you have given so much information in such a short amount of time, and I really, really appreciate that.
Thank you.
You know,
Thank you for having me.
Yeah, thanks for coming. I know you're so busy. We had to pull her out of the OR, you know, just to come here today. So we are happy. Thank you guys for tuning in.
Bye.
And please forward any questions that you have, either to straight to the YouTube channel or to our office, and we'd be happy to address those again. Bye-bye.